Mr. Booger. You look so different without your glasses.
That's yeah, I can barely say no.
It's the EJ and Jeans. Jeans business casual?
Yeah.
Oh, yeah?
It's laundry day.
All of them, the whole stack. What are you doing?
Good afternoon. How is summer going? How's your summer? Pretty good. What'd you shoot? No. I was a member, yeah. But you're all dying to get back to school, right?
Yes.
I am. I want to go back.
324 students. You betcha.
You betcha.
112 freshmen. You got it. We're ready.
Good number, 324. I like that. Okay, we have an exciting guest for you today. Mrs. Myers is going to introduce him in a minute. First, Mr. LaRocca would like to hand out the career matrix. We want to update it. I want to make sure we have the most up-to-date information. So if you just listen up to Mr. LaRocca, he'll give you some instructions.
Good afternoon.
Good afternoon.
This career matrix helps the operating committee to give us guidance as to which speakers we're going to bring in and everything. So it's important that we keep this up to date. You'll see your name here, and there's a red X for your first choice and a black X in your line for your second choice. If that's changed now for any reason, just put a number 1 and a number 2. Number 1 being your first choice in the career. If we don't have your career up here, write it out on the edge. If for some reason we missed your name, and Mr. V checked the list, your name should be on here. There's a blank down here, so just put your name in with a 1 and a 2. I'll start 3 sheets. The person on the end, just hold it, and I'll collect them at the appropriate time. And just do this while the doctor's speaking. I appreciate that. I also, most of you remember me talking about engineering. And about 3 months ago, I brought in a bunch of my professional magazines. I told you to keep them, take them home. Wealth of knowledge in here. In the back, you'll find careers, who's being hired, what the qualifications are. There's projects in here, not only in civil engineering, but I have PE in here, professional engineer from Ohio. So there's mechanical, electrical stuff in here. So if you're interested in engineering, you don't have to have the X on the sheet. If for some reason you think maybe someday you'd like to be an engineer, just take a book, take it home, enjoy it. Thanks, Tom.
Thanks, Rich. Well done. I'd like to spend about 5-7 minutes on a reflection from the last seminar. If you remember, we had Mr. Jim Sage. He has just recently joined the operating committee. He is the Chief Information Officer at Akron University, or Mr. Bruce, did he find a new position? That close. That close, okay. So for right now, he's the Chief Information Officer at Akron University. So, what did you find most interesting about Mr. Sage, his career path, what he had to say? Anybody? Haley.
I liked his point at how you technically need an education now to not hit the glass ceiling, especially the master's degree with employment. I think that shifting from the no college education to the bachelor's to now the master's is becoming the sought-out degree.
Yeah. I think that there is a cost-benefit analysis that Mrs. Myers or some of us could probably help in determining to go on for a master's for certain career paths. If you have to go now, if it's a necessity, if you can wait, do it while you work, if you can, obviously if you can find an employer who'll pay for your continuing education, that's absolutely the best that you can do. So when the time is appropriate, and that should be when you're ready to graduate from undergrad and you're still connected to the camp program, we can have those discussions and point you in the right direction. Who else? Who else wants to comment on, yes?
I liked how you proved all the stereotypes about IT careers wrong, how it's not just like a guy thing, and there's like a lot more careers than you think in it.
Right, I did like that. Yeah, it was like, you saw that slide. IT, it's a male thing. No, not, right? He said not, and it is not. What else? Anybody else? Look at your notes. Hopefully you took notes, or look at his bio. Look at Mr. Sage's bio. I do have extra bios, by the way, from Mr. Sage if you didn't get them. I will find them and then we can hand them out. Anything else? What about his offer that if you want IT, if IT interested you and you're looking for a career and or a job, he is the man that you need to talk to. I mean, that was pretty cool. I mean, he said there's over 10,000 jobs available in Northeast Ohio in the information technology field. And I don't know, Mr. Seifert, maybe you can chime in, but wouldn't you suggest that that IT, if you're looking for a minor or you're looking for something, you know, to get some experience in, wouldn't you agree that IT is invaluable in the industry today?
Yeah, I mean, I run a small company, a very small company. Just this year, we've had 3 people for our IT company, and 2 of the boys started with us, and 1 of the girls. 2 of them started off at $75,000 just coming out of college. Because it's just expanded. There's so much more to it than just keeping our computer systems running. There really is. I mean, there's so many security systems we got to be concerned about. And we use technology in terms of how we operate our company. Our people are out there with tablets working every day. So that's a big task, keeping 1,500 people working. So, I mean, and our head of IT, I mean, he's a great guy. Been out of school, I think, 5-6 years now, and I'm paying a lot more than that for him right now. But it was tough to find Tom. I think that was the biggest thing is we went on an interview, and it took us about 2-3 months to be able to find someone that we wanted. I mean, there was a lot of people that had some experience, but you know, we kind of needed to take a leap, and we named him a director of IT. It took us 4 to 6 months to find the right person.
You would think that with a wide open field, it would be a lot easier, but and with that many job openings, it would be a natural. But some people, you know, think that sitting in front of a computer all day is what it's all about. Plus the whole notion that it's a male-dominated field. I would highly recommend that you take a look at it. And those people that run IT in companies, they are making major decisions on the future of companies and what they're going to do with their information technology. So, and that's not going to stop. It'll never stop in IT. IT is a great career path for the long term. So take a look at it.
Hey, Tom,
Yes,
if I can add another comment. I don't know if anybody's been reading the papers probably the last 3-4 weeks, probably since the last meeting in June. I mean, Google and all those companies came out with the percentage of people that work for them. You know, it's a dominated white male. You know, the Asian, the female, the blacks have not been part of the employee workup. They're getting a lot of heat to be able to, you know, improve upon that. And now they're trying to really reach into the high schools to get these people to start developing, become writers or code and programmers and things like that. So they're, in fact, one article, I think it was in USA or Wall Street, one of them was, you know, there's summer camps they're setting up for high school students right now to like put the hooks in them right now to pursue that type of career. So, I mean, I think it's a fast career. In fact, you know, we thought maybe there'd be a glut at this point in life, but there's not. There's no question about it.
Yes, great point.
Yeah,
Yes,
I want to add that I mentioned it the last time after he spoke, medical informatics is huge. I'm sure Dr. Holbrook would probably agree that medical informatics is such, and it's growing so quickly, that it's still new. You can have a career in a hospital doing that. And I'm not just talking being with the insurance companies, because they have their own IT people too. But medical informatics in terms of research, a lot of other things that are going on at the hospital is huge. In fact, there's even talk about now being a medical informatics specialist. And I would just tell you, I'm only giving that as another option besides just thinking it's IT and all you're doing is working with computers all day. But this is actual research, and we're finding more and more, there's a lot of data out there, but to put that data together and then make clinical decisions or appropriate decisions for how to run a hospital or how healthcare is going, it's taking people like that that takes the next step in medicine nowadays.
That's a great point. So, when we pass out the sheets again, and by the way, how many of you are interested in healthcare? Bill, raise your hand. Hi. Raise them high so Dr. Holbrook can see. Okay, we have a very a majority of students. Certainly, if you're doing medical and you want a minor in information, I think that would be absolutely fantastic. Gives you a safety net. You're going through sophomore, junior year. You're like, oh boy, medical is really tougher than I thought. And you've got a minor in IT. Gives you something to fall back on. Okay? So we'll hand those sheets out again. I want you really to think about that. Okay, with that, Mrs. Myers is going to come up and introduce our guest speaker.
It's my pleasure to introduce my very good friend, Dr. Thomas Olbrich, and he's going to share with us his journey from high school student to a pulmonologist with the world-renowned Cleveland Clinic. So I will let Tom take you through his journey, and so Dr. Thomas Olbrich.
I was told I could use the stool if I want. I asked for the lectern. For as long as I have ever addressed a group of people, I've wanted to know 2 or 3 things. Are they here because they have to be or because they want to be? I'm told that most all of you are here because you want to be, so hopefully you'll find this informative, educational, and maybe even entertaining. I've also been told that you should start with jokes. A friend of mine once said to me, however, that chances are the jokes you're going to tell to this group of people are going to be horribly outdated or inappropriately dirty, so I'm not going to tell you jokes. But what I would hope to do is talk with you a bit about what I do, how I got to where I am, what I like about what I do, what I don't like about what I do, and then leave time for questions as much as I don't want to. Because traditionally when I've given medical talks, I keep 2 or 3 things in mind all the time. First is to keep in mind that chances are you know more about the topic you're presenting than your audience does. Secondly, that you should always keep in mind that different people in the audience are at different levels, so you've got to say something that appeals to all of them in their own personal way. And then my third point is that I always prepare enough material so that although there's supposed to be time for questions at the end, I've used all of the time that I'm allotted to have, and as such, there will not be time for questions at the end, because chances are I'm not prepared to answer them. So today, I'm going to follow along. Feel free to scribble on my bio. I thought about putting up slides. Every time I've ever gone to a medical lecture, at the end they ask you to critique the lecturer and the knowledge of the speaker and the mode of presentation. And I decided not to use slides because in the large majority of cases, the speakers tend to stand and talk to their slides and the audience has fallen asleep. Besides the point that what I've been told about this group is that you want to hear about how I do, what I like about it, what I don't, then I'm not going to throw up a bunch of statistics. If you ask me questions about my statistics, I'll tell you, but actually that does remind me of a joke. But it'll be incredibly informative. So the joke I'll start with is, About 6 or 8 months ago, we interviewed a nurse practitioner because I was asked to staff 2 clinics for the Cleveland Clinic, one in Worcester and one in Medina. At the time I was asked to do it, I was the only one there. And I could only be there 2 or 3 days a week, and somebody else had been there for 3 to 5 years, and so there was a very full clinic and just me to take care of it. And so the department agreed to allow me to hire a nurse practitioner, and I had the option between, we narrowed the choice down to 2. A nurse practitioner had been doing what she'd been doing for over 20 years, plenty of experience taking care of pulmonary patients, lung disease patients, as well as she'd also worked as a nurse in a hospital. She'd also worked as a nurse in an intensive care unit, so she had boatloads of experience. And then the other one was an RN who had just finished nurse practitioner school the month before she applied for the job. And I elected to take the nurse practitioner who had just finished her training because I didn't want to have to worry about being compared to someone else that the other nurse might have worked with, about how I do things compared to how the person she used to work with did things. And mostly I wanted to be able to shape this person into the role that I thought she could serve. And she's more than exceeded my expectations. But the story comes up on the first day. She said, you know, Dr. Ulbrich, when I met you and I interviewed with you, I asked you a lot about working for the Cleveland Clinic and I asked you a lot about the position, but I didn't learn anything about you. So, you know, before we start seeing patients, can you tell me a little bit about you? And I told her a very condensed version of the story I'm going to tell you today. And I said, so do you have any questions? And she said, you said you went into medical practice in July of 1986. I said, that's correct. And she says, you know, I wasn't even alive then. And I looked at her and I said, your first day, this is where you elect to go on your first day. And she said, you know, come to think of it, you might be as old as my dad. And I looked at her and I said, really, on your first day, this is where you're going. And she says, yeah, by the way, when were you born? And I told her I was born on February 29th, 1956. And she says, oh my God, you're older than my dad. So Ms. Myers and I were speaking a few moments ago as we came in that it's very hard to remember being in these chairs. And it's also, from what I remember being in those chairs, frightening to be in these chairs. Because clearly you're giving some thought to your future, and you're in a place to gain the knowledge that these folks who are voluntarily here to help you acquire, so that you make good choices. I would suggest to you, before I talk about how I got to where I got to, is that you have time. And Mr. Venturella was impressed that here I put in my career path that I initially thought I wanted to be a dentist, and I'm now a lung specialist. And we'll talk about how that came to be, but you have time to make choices. Just every choice you make needs to be the right choice. And if it happens to turn out after the fact to be the wrong choice, you have to learn something from that choice so that you don't make that same wrong choice a second time and a third time and a fourth time. But anyway, today I am a lung specialist with the Cleveland Clinic. And so 5 days a week. 5 days a week I do outpatient clinical work. And I see patients rarely that come to me directly on their own. In the huge majority of cases, people in medical subspecialties see patients that are referred from the house, from other physicians or other caregivers. And so it's not common for me to see the common cold, then a bloody nose, then diabetes, then high blood pressure. I see patients with asthma, I see patients with pneumonia, I see patients with emphysema, I see patients with pulmonary fibrosis or scarring in the lungs. I see patients both in the outpatient setting as well as in the in-hospital setting. And typically my day is set up so that I have a certain number of slots set aside for a new patient, a certain number of slots set aside for follow-up patients. And the follow-up patients come back at intervals depending on how stable or unstable they are. When I'm not seeing patients in this general pulmonary clinic, I am making hospital rounds. I have 2 partners with me now in Worcester and Medina, and so one of us is always in Medina Hospital making rounds on however many patients we currently have of our own admitted and how many may be consulted to us from other services. And If I'm not doing those things, then I am periodically scheduled to do procedures on patients. We do a couple of different types of procedures where we're looking down into lungs, taking samples, things of that nature. And then when I'm not doing that, I'm on 3 different committees with the hospital, Pharmacy and Therapeutics Committee, a Medical Ethics Committee, and I had previously been on the Lung Transplant Committee. So it's a pretty full schedule. Before I did this, I was actually 50 years old when I was offered this job. So I've been there for the last 8 years. Before I did this, for 20 years, I was in private practice with one other partner in Akron, Ohio. And we had a general pulmonary medicine practice, and we also did pulmonary medicine as outpatients and inpatients, but it was just 2 of us. And I joined him in practice in 1986, and for 20 years, I worked every other weekend for 20 years. Since I joined the Cleveland Clinic, I've worked 1 weekend out of 4. Part of the message I hope to communicate to you is the other thing that you want to look at besides learning from your mistakes so you don't make the same mistake twice is that you find balance in your life. You have to work really hard to be good at whatever it is you choose to do. Really hard. But you can't work so hard that you forget to take advantage of all of the other things that are around you in your life. And while I was at Akron City Hospital for 20 years, I also was involved with medical staff politics. I was elected as a representative of the Medical Executive Committee. I served on the hospital's board of directors. I also joined the faculty of Northeastern Ohio University College of Medicine, which was neo-UConn back then in 1986 when I first went into practice. And by the time I left in 2006, I was the director of the Division of Pulmonary and Critical Care Medicine. And I enjoyed all of that stuff. But all of the stuff other than my practice of medicine was volunteer work, like the work that these folks are doing. So that, I heard somebody mention something about salary or scholarship of $55,000. When I started my practice, when I joined my existing practice in 1986, my base salary was $55,000. Which today doesn't sound like a lot of money. It's a lot of money then, but it doesn't sound like a lot of money. When I left my practice in 2006, for the last 10 years before I left, I was making $180,000 a year. But I was working every other weekend. I was working 5 days a week. I was working 12 hours a day. And if you think about it, if it's every other weekend, so that's 26 times 2 is 52, plus the 5 days, 50. I was working over 300 days a year to make $180,000. So is that $600 a day? Which you break down into however many hours, 12-hour days. It's a good hourly wage. And then when I took the job with the Cleveland Clinic, not only did they offer me a more favorable call schedule, but because they were looking for folks with clinical experience, I got a bit of a raise. So it's turned out for me at the age of 50 to have a very nice career alternative made. But you don't always get that chance. So the other point about not making the same mistake twice is you pick a career path and you want to dedicate yourself to it. But you want to keep your eyes open for possibilities and opportunities all the time. Now, so I graduated from Youngstown Ursuline High School in 1974. I was 13th out of a class of 333 students. I went to John Carroll University because it was far enough away from home that I didn't have to live with my parents, brother, and sister, but it was close enough to home that if I had a crisis, I could get home. And I will suggest to you one of the things that my former spouse disliked most about me was that when I would talk about my years, I would always say that my 4 years at John Carroll University were the best 4 years of my life. Because it was exactly that. It was an opportunity to be away from home, but be close enough to home if I needed it. It was an opportunity to learn how to learn. I mean, in high school, you're probably, if you're here, pretty bright students. And probably if you're pretty bright students, this test-taking stuff comes pretty naturally to you. But when you get to college, the level of expectation changes. And when that level of expectation changes, you've got to figure out how to learn. You're not just studying for tests, you're learning how to learn. So that although I majored in science, I could have majored in biology or chemistry or physics or whatever, and choosing a medical career, yeah, you want to get as much science exposure as you can. All of my most interesting courses were non-science courses. Film study courses, we watched Alfred Hitchcock movies, we watched Michael Ritchie movies, and you don't remember any of them. Those were way before you. And we talked about the movies for an hour to an hour and a half afterwards with the lecturer. A modern novel class, an American history class taught by a Jesuit priest, who rather than given specific history facts, would bring out the history facts as he told little vignettes. During the Civil War, when he's talking about slavery, he tracked a family of slaves from the Deep South up along the Underground Railroad till their freedom in the North. When he talked about the start of World War II, he talked about a family on the Lusitania that was sunk and led to America's involvement in World War I. So that it was those kinds of things that I remember. You'll get, my daughter, when she applied to college, she as well wanted to pursue a career in medicine, and I'll come back to this later. But she says, what do you think I should major in? And I says, major in anything other than science. And she said, why? And I said, because I don't know anything other than science. And all of the most interesting people that I know in my medical career and in my circle of friends and family are people who know other things. And in fact, probably even more so today than when I was applying to medical schools are looking for diversity. The community is looking for diversity. And so my son graduated from Georgetown with a degree in health system administration. And his GPA was 3.8. And he applied to 10 medical schools. And he wasn't even invited for an interview. My daughter graduated from college with a grade point average of about 3.75 to 3.8, but she majored in Spanish and she minored in history. But she took enough science classes to fulfill the pre-med requirements. And so she's now starting her 4th year of medical school at Case, and my son is in his 1st year of physical medicine and rehabilitation training in Loyola in Chicago. But again, pick a career path, stay open for opportunities, but don't narrow your focus too early. So when I graduated from John Carroll in 1978, the day before I graduated, I had applied to 11 medical schools. I had received rejection letters from 10 of the 11. And the day before my graduation, I got a phone call. I was out in the yard butchering a lilac shrub that my parents had in the backyard, and I heard the phone ringing, and of course, you didn't have it in your pocket. You didn't even have a cordless phone. It was hanging on the wall in the kitchen. And so I ran into the house. We had indoor plumbing then, but we had phones hanging on the wall in the kitchen. They had dials, though. They didn't have buttons. And I picked up the phone all breathless, and the other end of the phone is this Thomas Olbrich. I said, it is. He says, this is the Ohio State University College of Medicine column. And I said, yes. He says, you've made an application to us, didn't you? I said, yes. He says, we just wanted to call to let you know that we have a spot for you in our July class, which was maybe one of the happiest days of my life. So I called my parents, and I called my girlfriend, and I finished butchering the lilac shrub, and then we had a celebration that evening. In Ohio State from 1978 to 1981, I was fortunate enough, I got married after I graduated from high school, but within about a month of starting college. And when I started medical school at Ohio State, tuition was $555 a quarter. So a year of medical school cost about $2,200 when I started in 1978. My wife worked. And we found a very nice place to live that was owned by a fellow who was a postman. And I told him, you know, I'm a student, my wife's a teacher. He writes at the bottom of his rent, or at the bottom of our lease, I'll keep this rent at $250 a month for the entire time that you're a student. And, you know, I find out that people that are living in houses around us are paying $850, $900 a month for rent, so we got pretty lucky. So I didn't have to borrow any money to go to medical school. My wife paid my medical school expenses. And by the time I finished all my training, and I was getting student loans for anywhere from 0% to 3% interest, When I graduated from medical school, I probably had no more than about $25,000 worth of debt. My son and daughter both went to Wrestler Reserve Academy in Hudson. For high school, their tuition was $25,000 a year. So that Ursuline High School, when I started Ursuline High School, was $200 a year. It's now about $2,500 a year. So I went through medical training when it was not nearly as expensive as it is today to become a physician, which will explain some of my comments about challenges when I get to that part of the talk. After I graduated from Ohio State, I had a number of options for where I wanted to go to do my residency training. At that time, by the time I had finished college, I realized I didn't want to be a dentist anymore because I didn't want to spend the rest of my time in somebody's mouth. I had interests that were a little bit more diverse than that. And when I thought about residency training, I really didn't like pediatrics because my patients couldn't give me histories, because I found parents incredibly difficult to deal with. I didn't like surgery because I trembled, and I trembled as far back as high school and college years, and it was relatively early that my surgical teachers told me that I'd have no business in an operating room. Plus, I never really enjoyed the preoperative or postoperative management of patients in the operating room. OBGYN was kind of interesting, but my wife was scared to death for a couple of reasons of me pursuing that career, in that one, the schedule is incredibly unpredictable, and two, for other inappropriate reasons that can lead to dirty jokes, which I'm not going to tell. And so I picked internal medicine, and the reason I picked internal medicine was because I liked the intellectual challenge. I often refer to myself, even to this day, to my patients as a medical Columbo. And if you don't know who Columbo is, you folks know who Columbo is. A medical detective, always looking for clues, always trying to piece together a puzzle, looking for a little bit here, a little bit here, a little bit here, till you figure out what's wrong with the patient so you can do them the most good. And so I went to Akron City Hospital to do my medical residency, and I got one of these. And so I put it on. And right, is anybody here a varsity athlete? Put on a uniform, right? And when you put on a uniform, you're still yourself. But now you're part of something bigger than you. And you have a responsibility not just to you, but to those who are on your team, but those who are counting on your team. So something's different when you put this on. And perhaps to my advantage or to my disadvantage, I consider that ever since I put on this coat, this defines who I am. Doesn't necessarily just define what I do, but it defines who I am. I've always been of the opinion that everybody works hard. Whether you're a pharmacist, whether you're flipping hamburgers, whether you're waiting tables, whether you're a mechanic, whether you're an engineer, whether you are whatever it is you do, everybody works hard if they're good at what they do and they care about what they do. But I have a number of friends that are in non-medical fields who've achieved tremendous successes. Yeah, but when I make a mistake, patients don't die. And that's an incredible responsibility. And that doesn't go away when you take this coat off and hang it on your closet door when you go home at night. And that's a burden that doesn't get any easier to bear after doing it for 30 years. So when you're putting this coat on, expect to wear it every hour of the day for every day of your life until you stop doing what you do. Now, of course, as I've had my opportunity for transformation, I went from being in private practice, I still actively practice medicine, but now in a much larger group, and I'm still taking care of patients. Other folks will come out of medicine and maybe they go into the medical industry. I have a fellow that I did residency training with that's the medical director for a drug company. I know Mike Marvin and I were residents together. He practiced emergency medicine for 15 years and then went into occupational medicine. I have a friend of mine who's a nurse, who was a critical care nurse at Akron City Hospital, went on and got a master's degree in nursing and currently works for St. Jude's Medical, marketing cardiac devices. Pacemakers, defibrillators, coronary artery stents, and things like that. So there's always opportunity to take advantage of, but when you're doing what you're doing, there's nothing more important than what you're doing. Nothing. And that comes at a price, which I'll come to in a little bit. The other prop I brought with me is this. I remember when I was a medical student, I couldn't wait to get one of these. Pardon? Yes. Now, again, some of the older folks in the group may remember this commercial. I would imagine none of the students have seen it. I'm sorry? Yeah, it's a pager. The commercial, yeah, so I once went into a club, a bar, and I got this pager on my waist, and everybody in the bar, I'd never been in this place before, says, well, this guy must be either a doctor or a drug dealer because no one else wears pagers. And so we had a little conversation about that, but there was an old commercial by Corona Beer. And there's a palm tree on either side, and there's the ocean rolling in, and there's an arm that comes in from the side, picks up a stone, skips it out into the ocean, and they got this music playing and this little speech about Corona Beer, picks up another stone, skips it out into the ocean, and then you hear this beep, 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 and you see this little light flash on the table where the stones are, picks up the pager, skips it out into the ocean. And this goes along with, you put this coat on and you have it on all the time. Even when I am not on call, I'm carrying this. Because you never know when the person who's covering for you gets sick or gets handed a pile of work that's much too big for him or her to handle, and you want to stay available to help to take care of those that are helping you to take care of patients who need you to take care of them. My third prop is the stethoscope. They say it's becoming a tool of the past. When I was a medical intern and resident, you spent a lot of money on these things. This is about my fourth or fifth stethoscope in 30 years of practice. And everyone is getting a little bit lighter, and everyone is getting much less expensive, because what you find is it's not the price and the quality of the stethoscope that makes sense about what the stethoscope is hearing, it's what's between the earpieces. So that part of the reason they say that this may be obsolete is because technology has gotten so good that you see things and you hear things with testing and with imaging and with other things that you can never pick up with your hands or with a stethoscope. But what this allows you to do is this allows you to get really close to a patient and touch them in places where if you touched them in public, you would get arrested. And it's just another affirmation of this kind of incredible degree of trust and responsibility people who come to see you place in you. They come to you when they don't feel well. They come to you when they're vulnerable. They come to you when they're dying and they're hoping that you can do something for them. And when I picked my career of pulmonary medicine, a number of my other friends going into cardiology and gastroenterology said, well, why do you want to go into pulmonary disease? There's nothing you can do for patients with lung disease, and I couldn't believe that there is anything further from the truth. Because you can always do something for somebody. You can't always make them better, but you can always do something for them, whatever that might be. So after 3 years of medicine residency at Akron City Hospital, where I thought I was going to be a general internist, I decided that I hated going from my clinic room of headache to dysmenorrhea, to diarrhea, to diabetes, to high blood pressure. Because you have to be good at everything. And I also found out that it was incredibly frustrating to me when I would take a patient to the point of clinching their diagnosis and offering them definitive therapy, I had to pass them off to a specialist. And so when I thought about all the different specialty training I did during my residency, I came up with pulmonary medicine because I can do an outpatient practice and I can maintain long-term relationships with people. I can continue to see those patients when they come into the hospital and they're sick. And when they get even sicker and they go to the intensive care unit and end up all wired up in tubes here and there and everywhere, I can still continue to provide care to them. And I can also do a variety of different diagnostic procedures that my tremor doesn't impede. And I'm an expert in something. And people call me up and they ask me for opinions. And I get sent patients who no one else has figured what their problem is. And you get this reaffirmation when you make a diagnosis and you prescribe a course of treatment and the patient comes back to see you a month later. And gosh, I can't believe how good I feel. So that's how I ended up in pulmonary medicine. And so after doing what I did for 20 years in Akron, Ohio, I joined the Cleveland Clinic. And for a period of time, I worked on the lung transplant committee, worked in the lung transplant clinic, and those folks were incredibly motivated and incredibly grateful, but there were also very few of them. And the huge majority of patients with lung disease aren't going to be candidates for lung transplantation. And so when the clinic offered me a position going back into general pulmonary practice and general critical care medicine, I leapt at the opportunity. So that's how I got to where I am today. If I look next at education, I've already applied some of this already. You can major in whatever you want to major in high school and or college. You just have to take enough stuff to fulfill the requirements for graduation and the requirements for your given field. I mean, obviously, if you're going to go into engineering or computer technology or information technology, you're going to want to concentrate on mathematics and science stuff. If you want to go into a medical field, you're going to want to take enough biology and chemistry to fulfill those requirements. Back when I was in medical school, and Mike would comment on this as well, the litmus test for college students in medical school was organic chemistry. Organic chemistry are the only 2 C's I have in my entire academic record. And I'm not sure, but I think that's probably why I got 10 rejection letters and only 1 acceptance to medical school. They were the only 2 C's on my son's academic medical record. Probably kept him out of medical school the first time he applied. My daughter got A's in both semesters of organic chemistry. She evidently is smarter than all of us. It's just an incredible volume of material. And the way that we registered at John Carroll, you registered in order based on how many credit hours you had and what your grade point average was. So when we're finishing our general chemistry class at the end of the freshman year, we're asking all the sophomores who just finished organic, who's the best teacher? So everybody mentions this Dr. Walsh fellow. So of course all the brightest students with the most credit hours sign up for Dr. Walsh's class. So we have 40 students in his class, and after the first 2 exams, he's got 22 A averages. And as he's passing out our 3rd test, he says, I want you to know, as he's walking around the room amongst us 40 students, I want you to know that there are 22 A averages in this class after the first 2 exams, and that will not stand. And the class average on the next exam was 50%, and then 55%, and then 60% on the last exam. And I think the only reason I managed to get a C in both of those semesters was I got B's on the final exam. So that, I guess the point of that story is, 1, it's an incredibly difficult course, and 2, that throughout your educational career you're going to run into some jerks. But you're going to learn from the jerks as much as you will learn from those that are a little easier to get along with. We had an attending physician at Akron City Hospital when Mike and I were residents, who's since died, God rest his soul. He was thrilled when the medical school called to his attention that one of his students rotating on his kidney service had written on his evaluation, Dr. Blank is relentlessly malignant. Now, I was interested in being a general internist. By that point, I was thinking I'm going to go into pulmonary disease and critical care medicine, but when I took my internal medicine boards, which basically test your ability to provide general internal medicine, medical care, my highest scores were not in pulmonary medicine or critical care medicine. My highest scores were in kidney disease, renal, and nephrology. So you've got to find a way to get beyond the crusty exterior of some of these folks and take what they have to offer to you. Because what I realized, 1, while I was training under this man, and secondly, when I had the privilege of practicing next to him for 10 to 15 years, is all he was trying to do was help you to realize your potential. And that's all any of us can hope to do, is help people to realize their potential. Career counseling, medical care, whatever it is. Help people live as good as they can and as well as they can for as long as they can. The medicine residency, family practice residency, pediatric residencies, depending on what you want to go into, are typically 3 years. Surgical residencies for general surgery, 5 years. When I was in training, everybody was going into specialties. Specialty training was anywhere from 2 to 3 years for medical subspecialties, 3 to 5 years for surgical subspecialties. There's been a big push in medical administration over the last year, and quite frankly in social policy, to direct people more towards primary care practice. And primary care practice today has changed. It was not unusual back when I went to training that internists or family practitioners would follow their patients into the hospital. When they were discharged, see them after they went home. It's very unusual today now for the same physician who's caring for a patient as an outpatient to continue to see them during the hospital. And that's driven by cost and efficiencies of care, and I think it's wrong. But it's the system that there is, and so you try to figure out a way to make it work the best you can for you. One of the most frustrating things of my medical training was by the time I had finished my specialty training, I was still looking, or by the time I finished my residency. You know, when you graduate from medical school and you look for your residency training, you sign up for a match. You interview a bunch of places, they put your name in a hat as to where they think you fit on their list. You put their names in a hat based on where you think they fit on your list. And then they throw all that into a computer and you match. And once you're graduating from medical school, that's a pretty exciting time. When you're finishing your medical residency and you apply to 12 fellowship programs for specialty training, and you list 6 of them on your application form, and you get the match letter on June 2nd, a year before you're finishing your medicine training, and you don't match at any of those programs, you're not very happy with that far into your career. Your choices are still left up to the whim of a computer. Now I ended up calling 3 places after the match came out, and I hadn't matched. And part of the reason that I got, in addition to the 3 places I called, 3 additional phone calls, is I interviewed with a fellow by the name of Tom Petty, not of the Heartbreakers, but a big time pulmonary physician back in the early to mid '80s. And he was the director of the program at University of Colorado. At that time, probably the highest ranked pulmonary program in the entire country. And I started my morning with him, and during the course of that day, I interviewed with him, I interviewed with folks at the university, I interviewed with folks at Denver General Hospital, I interviewed with folks at National Jewish Center for Pulmonary Medicine, which today is still the #1 ranked pulmonary program in the entire USA. And at the end of the day, I had my final interview with Dr. Petty, and we're walking down the hallway from his office to his elevator. And on the walls, both sides of the hallway, 3 deep, 3 high, pictures of everyone who's ever trained. And he's saying, so-and-so is the director of pulmonary medicine at the Oxford Clinic in Louisiana, so-and-so is the director of pulmonary medicine at St. Louis, so-and-so is blah, 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 this and that. And I got to the end of the elevator, or end of the hallway with him, and I said to him, he says, do you have any other questions? I says, well, I just want to thank you for inviting me out. And he says, what do you mean? I says, well, you know, clearly you train incredibly high-quality people, and I'm totally impressed with your program. But I'm coming from a well-regarded, but still relatively small community hospital-based training program in the Midwest. And I think I may have wasted your time today. I fear I may have wasted your time today. And he looked at me square in the face, and he said, you know how many applications we get for our 6 fellowship positions? I should know. He says, 600 applications for 6 positions. He says, we cannot interview everyone who applies. So you've already been selected. So 1, you didn't waste my time. And 2, the other reason I'm showing you all of these people, and I'm telling you all of their names, is because when match day comes, if you don't match, or if their programs don't fill, all of these people that I've trained call me up. Who did you see that you didn't take that might be worthy of my consideration? And that's how I ended up with my fellowship position. So again, even when you perceive a failure, something good may come out of it. And for me it did. And I ended up in a very good training program. I never wanted to be a pulmonary academician. I wanted to be a clinician. I wanted to take care of patients. And if while I was taking care of patients I could provide education, that's what I wanted to do. So it worked out fine for me. So even when you're kicked in the gut or in the other places, and you don't know that you're ever going to recover, there's recovery. So keep that in mind too. So what do I like about what I do now? I've already told you I still get a big kick out of making a diagnosis that no one else has made. Someone who's been symptomatic for years, and within 15 minutes of talking to them, you know what the problem is, and you can stop the interview there, but you don't, because you want to hear the rest of their story. And then you tell them what testing you think you should do and why you should do it, what your alternatives might be and why. And then when you make that diagnosis and you prescribe therapy and they come back and they're feeling better. That is better than anything. Better than anything. I like when patients compliment me. Doctor, no one's ever taken an hour to listen to me. Well, that's part of the reason in our clinic we schedule an hour for a new patient. Is so that you have the opportunity to explore something that somebody else who was scheduled a 10 or 15-minute visit might not have had the opportunity to explore. And I learned back when I was a high school student, actually. Our family doctor, I didn't think was a very good role model. He'd come into the room, his nurse had already taken all of our history. He would come into the room, he'd go to his little desk in the corner, and he'd stand at this little desk, and he'd ask a couple of questions, and he'd scribble notes. And then he'd come over and he'd examine you for a couple of minutes. And then he'd go back to his desk and he'd scribble a couple of notes and he'd write a prescription, and on his way out the door he said, take this and call me if it doesn't get better. Never, I think it's this. This is the way I think this medicine's supposed to work. This might be the side effects. In 1996, in September, my father was dying in an intensive care unit, on a mechanical ventilator with a tube down his throat, unable to speak. Sedated, but alert enough that he knew we were there. Hands tied down to the edge of his bed so that he wouldn't accidentally or inadvertently pull tubes out of his mouth. And during that last 24 hours, his doctor visited me, my brother, my sister, and my mother 4 times in his last 24 hours. And I thought did an extraordinary job of communicating to us what was going on with my dad. As well, when I first arrived at the hospital that day, the physician taking care of him was somebody who I knew from our medical school faculty, walked me into the ICU, introduced me to all the nurses, said, this is Dr. Olbrich, he's a colleague of mine, he's Mr. Olbrich's son, he can look at anything he wants to look at. And I looked at my dad's admitting labs, and I knew he wasn't going home. And so every time the doctors would leave the room, my mother, brother, and sister, all of whom were college educated, 2 of whom were college graduates, would look at me and say, what did he just say? And so you try to translate it. And the last visit, which was about an hour and a half before Dad died, they looked at me and said, what did he just say? I said, Dad's not coming home. I mean, you have to communicate to people in words they're going to understand. Which is why I've chosen not to use a bunch of song references or literary references or movie references, which, again, you probably wouldn't recognize. I still have, looking down here at motivation, I still have every gift that has ever been given to me by a patient, except for the ones that you could eat or drink. So, for me, and again, what motivates me? I was seeing a patient for the first time, and her first visit was between Christmas and Thanksgiving. And that's a time when a lot of folks are kind enough to bring in cookies and baked goods and things for the physicians and the staff who are taking care of them as a way to thank them. And so at the end of our visit, she says, I think I like you, but it's clear you don't need anything else to eat. What do you like to drink? And says, well, I've been known to have a glass of Jack Daniels now and then. So every Christmas for the next 10 years, this woman scheduled an appointment in my office in December and brought me a bottle of Jack Daniels. So when I took the job with the clinic, first time I met this elderly woman who I still see today, I'm telling her this story. And she says, do you still drink Jack Daniels? I says, well, no, I'm a little bit more of a vodka fan now. And so for the last 6 Christmases, this lady always schedules an appointment during December, and I get a bottle of Grey Goose vodka. And during the last 5 years, I was part of the transplant clinic. Just yesterday, I got an email from a patient because I had sent an email to them thanking them for the world's best cookies I have ever eaten. Combination of chocolate chip, peanut butter, and oatmeal, all in the same cookie. So she sends me this email, did the cookies arrive? And I said, yes, they did. I says, I have to tell you, though, they arrived after I left clinic on Thursday for a meeting. And when I came in on Friday morning, they were half gone. Now, my staff told me that that's the way they arrive. By the end of that day, the rest of them were gone. Thank you so much for thinking of me. And so I've saved all of those things. And I also think the 2 other things that I like about what I do
is I like when people are satisfied, and I like knowing that I made a difference for someone. Now, what did all that come at the price of? Well, I mentioned my father. He died when I was 40. That was the second of three crises that hit me during my 40th year. I turned 40, my father died, my marriage started to crumble. And my marriage started to crumble, and I separated from my first wife for the first time when I was 40 years old. And I think to this day, it's because when I went away to college, I put my nose to the grindstone. And I kept it there until I was 40. Which is why I started a little bit earlier with the point, work hard. Take pride in what you do, but find balance. I never found balance, not till after I turned 40. That marriage ended. As that marriage ended, we went through divorce counseling with my kids. My kids beat me up about how I was never around for things that they needed me to be around for. They seem to have forgotten me reading them bedtime stories. Of course, they remembered me falling asleep while I was reading them the stories and their mother finishing the story. They seem to have forgotten me teaching them how to ride bicycles. But that's what they remembered, and that's what they shared with the counselors during our divorce proceedings. And oddly enough, as critical as they were of the time demands that were put upon me by my medical career, they both decided to pursue a career in medicine. So I'm thinking I must have done something right with that. And I'm hoping that at some point or another that it'll come back. I'm almost finished. A quote and a story. This is a great quote. But the one that I like is the one I read, and I can't remember how long ago it was, and it's right down there at the very end of my talk under motivation. People may forget what you said. People may forget what you do. But people never forget how you make them feel. So today in medical careers, whether you're a nurse, whether you're a medical technologist, whether you're drawing blood, whether you're reading x-rays, whether you're a nurse practitioner, whether you're a device representative, you're serving people. McDonald's is a service industry. Landscaping is a service industry. Selling hot tubs is a service industry. If your patient isn't satisfied, their grade of your performance as to how you made them feel now directly affects your hospital's reimbursement, your reimbursement. So you have to make sure that you communicate to your patients in whatever part of medicine you pick, that they know how important you are to them. So I can't remember how long ago I heard this story. This philosophy professor, do I have about 5 more minutes? This philosophy professor comes into class on the first day of class, and he's got about a 5-gallon glass jar that he puts down on the table on his desk in the center of the room, and all the students are standing around. And he comes in, he's got a wheelbarrow, and he's got about a half a dozen to a dozen rocks. And he puts his wheelbarrow in, and he puts all these rocks into the jar. And he asks the class, he says, "Is the jar full?" And all the students look, he's trying to put more rocks in, and he can't get any more rocks in. And they say, "Yeah, it looks like it's full." And then he comes in, and he's got 2 buckets of gravel. And he takes a bucket of gravel, and he dumps it in, and it whistles down between the rocks to fill the bottom of the jar. He takes a second bucket of gravel, he dumps it in, it whittles down through the rocks, and the jar is now full. And he asks the students, he says, "Is the jar full?" You can't get any more gravel, and it looks like it's full. And so he comes in with sand. And he's got a bag of sand. And he starts pouring the sand in. And the sand's trickling down between the rocks, and it's trickling down between all the gravel. And he gets a 40-pound bag of sand into the jar. Sand starts tumbling over the edge of the jar as he's continuing to pour. And he asks the students, "Is the jar full?" And they said, "Well, you can't fit anything else in it." And he says, "Well, You may still be mistaken. And he goes behind his desk and he opens a drawer and he takes out a couple of Budweisers, or Coca-Cola, or cups of coffee, or whatever the appropriate term is for this. And he opens up 2 cans of Bud and he pours them in until they start to run over the edge of the jar. And the point of the story is the rocks are the things that you have to put in place in your life that should always be there and should always be important. And those have to be set in first. Because if you put all the gravel in and you put all the sand in, it fills up the space for the basic core principles that are going to make you who you are and are going to help you to be successful in whatever you're going to do. So set the core first. Let the other stuff fill in around it. But never get so busy that you can't take time to have a couple of beers with your friends. And that's the end of my speech.